below. I'm happy to help. Other than that, keep working hard, keep studying hard. Let's get to the questions. Question 1, your client's treatment plan instructs you to measure the time it takes for your client to say you're welcome after someone says to them, thank you. What are you measuring? Okay, so think about our measurement systems, right? All the measurement questions consider how we measure behavior. Okay, if we look at our answer choices, we see this is a continuous measurement question. Okay, so we have frequency, rate, duration, IRT, and latency. If we look at our behavior, we are measuring the time from someone saying thank you to the time your client says you're welcome. So the time in between what? The time in between the SD, which is thank you, and the response, which is you're welcome. So when you measure the time in between the SD or the instruction to the response, what is that called? Is that rate? No, rate is frequency over time. Are we taking any frequency data here? Are we counting anything or seeing how many times something occurs? No, right? So it's not going to be rate. What about duration? Be careful because duration is measuring the length of one specific response. Here, we're measuring the time in between the SD and a response. Okay, so it's very important that you understand that distinction. What about IRT? Well, IRT is the time in between individual responses. Okay, so response 1 to response 2. This question is asking, what is the time in between the SD and the response? And the time in between the SD and the response is latency. Okay, how do you tell the difference between IRT and latency? IRT is going to be the same response typically. Okay, so if you're measuring the time in between your client saying you're welcome, okay, that would be more IRT, right? The time in between responses. Latency is an SD and a response, right? So thank you is the SD, you're welcome is the response. Okay, so pretty easy measurement question. If you've been studying, make sure you understand the difference between duration, IRT, and latency. They all have to do with time. We're just measuring different aspects of time. Question 2, Tom and Jerry are constantly picking on each other in class. They will try and make each other laugh, throw paper at each other, and distract each other during exams. On Monday, their teacher moves Tom to one side of the classroom and Jerry to the other side before class begins. Moving the two kids is a type of what? Okay, very common intervention, right? We have two children in one class messing with each other, distracting each other, throwing paper at each other. And the teacher says, okay, this week I am going to move them to other sides of the classroom. What type of intervention is this? When you're trying to determine what type of intervention you're looking at, ask yourself, does this occur before the behavior? Is it preventative? Or does it occur immediately after? Is it a consequence? And that immediately after part is important, right? Because Tom and Jerry are already distracting each other. The teacher doesn't move them until Monday, okay? So the teacher is trying to do what? He's trying to prevent this behavior happening again. A preventative strategy happens before the behavior and is considered an antecedent intervention. Strategies and interventions that occur immediately after the behavior are consequences, those like reinforcements and punishments and extinctions, right? If our intervention occurred immediately after Tom threw paper at Jerry, that would be a consequence. In this scenario, the teacher is trying to prevent the behavior from happening. When you're trying to prevent something, if it's preventative, that's an antecedent intervention. It happens before the behavior occurs. When you're reacting to the behavior, immediately after the behavior occurs, that's a consequence intervention. It's very important to understand those two distinctions, okay? Prompting procedure is a type of antecedent intervention, but no prompting is going on here. We are just making some sort of environmental change to prevent the behavior from happening. And then a punishment procedure is a consequence intervention. So a punishment procedure happens after the behavior. So just remember, when you're looking at different interventions, ask yourself, is it happening before the behavior happens or immediately after the behavior? Is it trying to prevent the behavior or am I reacting to the behavior? 3, Gabrielle is an aspiring piano player. She started taking lessons 6 months ago and is preparing for her first concert. She will play 3 songs back to back in an auditorium full of people. She can play all 3 songs without error at her house, but during rehearsal in the auditorium, she made 4 mistakes. Gabrielle's skills need what? Okay, very easy question. If you've been studying the study guide and you've done a few practice questions already, what are we trying to promote here? Well, we know what? We know Gabrielle can play 3 songs at her house without error. She goes to a different environment or different setting, and now she starts making mistakes. What is that behavior failing to do? The important thing here is understanding the difference between maintenance and generalization. Maintenance is when we stop teaching something and then we check to make sure that they can do it after a certain amount of time. Okay, has that behavior maintained? We're not trying to check for maintenance here because she's still working on the skill. She just needs to be able to do it in a different environment. And when we're talking about being able to conduct a behavior or do a behavior or engage in a response in an environment outside of the teaching environment, what are we talking about? Well, we're obviously talking about generalization. Gabrielle needs to be able to generalize these skills outside of her house into the auditorium. Gabrielle's skills need generalization. Generalization is one of, if not the most important parts of our treatment plan. If we're not generalizing, okay, we're not doing the best we can for our clients. For this reason exactly. It doesn't matter if Gabrielle can do the skill in her house if she can't do it when she needs to do it outside of the learning environment. So Gabrielle needs to work on generalization. There is no extinction going on, right? Because we're not trying to reduce the behavior. We're not trying to withhold reinforcement. And then motivation is there. There is a motivating operation to perform well for Gabrielle, so that is not going to be the issue. Gabrielle needs to generalize these behaviors outside of the learning environment. The game show Who Wants to Be a Millionaire offered the contestants 3 lifelines that they could use on any question they were asked. The lifelines helped the contestants answer the questions correctly. Lifelines served as what? So if you've never seen the show, it was a game show. The host would ask a question. The contestant would answer the question. Sometimes the contestant would call a friend or ask the audience, and that would help them answer the question. So in that scenario, the host asking the question is the SD. The contestant answering the question is the response. In between, they would use these lifelines. So what do we consider the antecedent between the SD and the response? Well, if it's helping the contestant engage in the correct response, that's going to be what? Is that a consequence? No, because like we just said, it's an antecedent. It occurs after the SD, but before the response. There's not going to be a consequence. We're not measuring anything, okay? So we have a prompt, right? A prompt does what? A prompt is a cue or a signal or assistance to try and evoke the correct response. In this case, we have our SD, the host asking the question, the contestant phones a friend or uses a lifeline. That prompts the contestant to answer the question correctly. Remember, prompts come before the SDs, but right before the responses. And that's what's happening here. So the lifelines, anything to help the correct response be evoked is going to be a prompt. So lifelines served as prompts. Graduated guidance is a type of prompt, but it's a type of physical prompting, right? When we gradually introduce physical prompts as needed and then quickly fade them. So our answer here is prompts. The most important thing to remember is the sequence, which goes SD, prompt, response. During supervision, your BCBA observes you as you run discrete trials with your client. Your BCBA stops you and tells you to deliver feedback and reinforcement quicker than what you are currently doing. They want the consequences to occur as close to the behavior as possible. How should you respond in this scenario? What your behavior analyst is doing is asking you to improve the contiguity of the reinforcement and feedback, but that's not relevant to the question, okay? On the exam, understand what they're asking What is the question asking? The question isn't really concerned about what they're telling you to do. They're more concerned about how you should respond to the feedback. Remember, on your task list, there's an item about feedback where you should respond appropriately. That's what they want to know. So always be sure you understand what the question is asking, because sometimes the information doesn't really matter. It's just more about you responding or what would you do. So this scenario, how would you respond to the feedback given during session? A, the BCBA should not be delivering feedback during session and in front of clients. Well, the BCBA really should be giving you immediate feedback. Immediate feedback is best. It's best in the moment. So it's totally acceptable, right? As long as they're doing it respectfully, they're not trying to embarrass you or humiliate you, which given our information, it doesn't seem like they are. So it is acceptable. A isn't necessarily the best choice. B, attempt to implement the BCBA's suggestions. Ask questions if you are unsure. This is pretty good, right? Pretty common sense, right? Most ethical questions are a lot of just obvious common sense things. If you're getting feedback, I'll attempt to implement the suggestions and then ask questions if you're unsure. Our task list says we need to respond appropriately to feedback and communicate effectively with our BCBA. B has both of those options. B so far is our best answer. Remember, on our exam, what are we going to do? We're going to read all of our answer choices and understand why the wrong ones are wrong. So C, report your BCBA to your boss for providing you feedback that you felt was inappropriate. Okay, well, given our information, nothing really inappropriate occurred. And before you went to that level, hopefully you would communicate effectively with your supervisor. And then D, ask to come off the case in response. Again, too strong ethics questions. We don't want a answer that is overly strong, okay, or overly dramatic, right? We just want the most straightforward, task list driven answer. In this scenario, how should you respond to feedback? You should attempt to implement the suggestions and ask questions if you're unsure. Remember, you don't always have to agree with the BCBA, but if you don't get offended or don't get upset. Simply attempt it and then talk to them about it. Open communication is an essential role or an essential part of that BCBA RBT relationship. Moving on, how would you describe the trend of the following data? So remember, when we're visually analyzing data, we can look at trend, we can look at levels, we can look at variability. This question is asking you to describe the trend. If you get a question like this with a table and some trials, don't be afraid to map it out. You would have a data point for 4. It would move up a little bit to 6, move back down to 4, move back up to 6, and then move down to 5. Now, some people can visualize that in your head, which is fine. If you can't, doesn't matter, write it out. But once you write it out, what are you going to notice about the trend? Is it increasing? Well, it increases, then decreases, increases, and decreases. We can't definitively say it's increasing. Decreasing is the same thing, right? It first increases, then it decreases, then it increases again, and then it decreases. So really, there's not much trend at all, okay? A true trend would be data like 4, 6, 8, 10, 12. True increasing trend, or you just reverse that and you have a true decreasing trend. The best way to answer these questions is to just write it out, draw it on your scratch paper, and then visually analyze it. That's what we do anyway in ABA, a lot of visual analysis. When you draw it, it's very clear that there's no trend. Don't be intimidated by the graphing questions. They will ask you, 3, 4, 5, maybe 6 graphing questions, but all you need to know are the basics of graphing. I have a great video on graphing on my channel. Be sure to check that out. But end of the day, you just need to really know what an x-axis is, what a y-axis is, and then what trend and variability are. And if you can do that and you can look at a graph and know it's a line graph, you'll be fine. Don't freak out about the graphing questions. Do a couple, and those will be the easiest questions on the exam. On Thanksgiving Day for lunch, you ate the following items: turkey, stuffing, cranberry sauce, gravy, rolls, green bean casserole, macaroni and cheese, pumpkin pie, and pecan pie. That night you skipped dinner. You're most likely what as it relates to eating food? If you're like me, you ate a lot of food on Thanksgiving, and then you either had a small dinner, or you ate leftovers, or maybe you skipped dinner entirely. What happened? You're most likely what as it relates to eating food? So this is going to be a motivating operations question, an MO question. Remember, our MOs are motivating operations. They're antecedents. They make you want or not want something, meaning they increase the value or decrease the value of a reinforcer. In this case, what happened? You ate all this great food, right? The value was high, high, high. After you ate that food, you skipped dinner and you decided you didn't have to eat food anymore. You didn't want to eat food anymore. What happened? The value of that food decreased. Were you deprived of food, or were you satiated on food? Well, deprived has to do with not having enough, but you clearly had plenty of food. Therefore, you were satiated. Those are two key words you need to know. They're both related to motivating operations. Deprived is not having enough, typically will increase motivation. Satiated is having too much, which will typically decrease motivation. You were most likely satiated on the food, therefore you did not eat dinner. You weren't motivated to eat the food. The deprivation is typically associated with increased motivation, but you were satiated, and then non-compliant is irrelevant to our question. You were most likely satiated as it relates to eating food. This is a motivating operations question. MOs, especially if you just started studying, can be difficult to understand. It's okay if you don't understand them right away. Move on to other stuff. Learn all that other stuff first, the easier things. Come back to MOs later, okay? Hopefully it'll make more sense. A DRI procedure that targets students walking around the room while the lecture is going on would most likely include what? How to start with this question, okay? Very brief question, straight to the point. It's asking you what is going to be included in a DRI procedure. The easiest way to do that is just think through a DRI. What is a DRI? It's a differential reinforcement of incompatible behavior. Okay, so what are we doing? We are trying to teach a new behavior that's incompatible with the old one. Okay, how are we going to do that? We're going to reinforce a new behavior and put the old behavior on extinction. And now you have your answer, right? So we know we're trying to target students walking around the room while the lecture is going on. So most likely, we're going to put that behavior on extinction, and we're going to be looking for a new behavior, one that's incompatible with that, to reinforce. So let's look for that. A, reinforcement in the absence of walking around the room. What procedure do we reinforce in the absence of behavior? Well, that's a DRO, right? A differential reinforcement of other behaviors. That is when reinforcement occurs in the absence of a target behavior. We're not necessarily reinforcing any behavior in particular here. With the DRI, we're picking a new target behavior. That's what's wrong with A. A is more of a DRO. What about B? Reinforcement when students were sitting in their chairs during the lecture. Yes, right? We just said we need to find a replacement behavior that's incompatible with walking around that we can reinforce. B, sitting in their chairs is incompatible with walking around. Perfect behavior to reinforce. B looks great. Let's keep reading. Always read all of the answer choices. C, restraint procedure to ensure students did not leave their chairs. Definitely not response blocking. That is some sort of punishment procedure, right? Differential reinforcement involves reinforcement and extinction, not necessarily punishment. And then D, an antecedent intervention targeting the seating arrangement. That's great and all, but differential reinforcement is a consequence intervention. The only answer that fits here is B, reinforcement when students were sitting in their chairs during the lecture. Make sure you understand this question, why B is the answer, and what the difference between the DRO, the DRI, and the DRA are. Yesterday, Roman arrived home from work and saw that his son drew all over the wall with crayon. Roman made his son repaint the wall with him, which led to his son not drawing on the walls. This is a what procedure? Looking at our answer choices, we see it's a reinforcement, punishment, extinction question. Where do we start? Well, let's ask ourselves, was something added, was something taken away? Was reinforcement withheld? We know reinforcement wasn't withheld in this scenario. There's no mention of reinforcement not being given. Therefore, we can eliminate extinction. Extinction is withholding reinforcement. for previously reinforced behavior. We're now looking at some sort of reinforcement or punishment. Ask yourself, did the behavior increase or did the behavior decrease in response to the consequence? Well, Roman saw the crayons on the wall. He made his son repaint the wall. His son no longer drew on the walls. Did that behavior increase or decrease? Decreased. We're looking at a punishment procedure. When the behavior increases, it's reinforcement. When the behavior decreases, it's punishment. Now we just need to ask ourselves, is it negative or positive? Meaning, did something get added, positive, or taken away, negative? Well, the punishment was added. His son repainted the wall. Therefore, this is positive punishment. Very straightforward. When we're looking at consequence interventions, reinforcement, punishment, and extinction, ask yourself, if you're looking at extinction, was reinforcement withheld? No. Then did the behavior increase or decrease? And then was something added or taken away? Very straightforward. Reinforcement and punishment after learning your functions should be the next thing you learn. So if you're new to studying, get these down first. It's going to really help you on the rest of the exam. Finally, you're assisting your BCBA with an indirect assessment. During the assessment, the parent says, the behavior I am concerned with is aggression. The antecedent to the behavior is when I tell him to pick up his toys. The function is frustration. The consequence is timeout. The behavior occurs 3 times per day. What part of the parent's explanation is incorrect? So actually not a bad explanation for a parent. We've got antecedents, we've got consequences, we've got functions supposedly, and then we've got how many times this behavior is occurring throughout the day. It's just a measurement. Not bad. However, what is wrong with this explanation? And I hope something jumped out to you because something should have really set off alarm bells. Is the antecedent incorrect? The antecedent is when I tell him to pick up his toys. No, that seems like a plausible, reasonable explanation or antecedent for aggression. Antecedent's fine. What about the consequence? The consequence is timeout. Regardless of how we feel about timeout, that is a consequence. So the consequence explanation is totally fine. What about the function? The function is frustration. What are our functions? Escape, tangible, tension, automatic sensory. Is frustration a function? No. Okay, so that is what is incorrect about our explanation. Frustration is not a function. And then the behavior is fine. Aggression, it occurs 3 times per day. The answer here is the function. Okay, I hope you enjoyed. Thanks for watching. Please like and subscribe. Check out all of our study materials at rbtexamreview.com, our task list study guides, our practice exams, and our combo pack. We also have BCBA materials available as well for when you pass your RBT exam. Other than that, any questions, let me know. Keep working hard, keep studying hard. I'll see you soon.